So I'm going to do a quick demo of ultrasound, even though you're not going to be lab tested on it until the summer. I thought maybe it would help you with a lecture test to have an understanding of how ultrasound is performed, okay? So I picked a patient who actually needs tissue heating and needs increased tissue extensibility of the calf muscle, the gastroc. So we're going to use our parameters of 1 megahertz frequency to go for a deeper penetration of treatment. Our intensity parameters can be anywhere from 0.5 to 2.0 watts per centimeter squared for that one. We want to be in a continuous mode to get thermal effects, remembering that we also get non-thermal effects when we do that as well. Right? We want to position our patient appropriately, and it's very important that we drape well so that none of the lotion gets on his clothes or starts dripping down his leg or anything. So please use enough towels to drape appropriately. Clean the area, go through all of your contraindications and pre-assessments before you begin. Then you're going to set up your ultrasound machine. You're going to look at time component. So 2 sound heads equals about 5 minutes. And we're going to be doing an area on him of 3 sound heads, so that's 7.5 minutes that we're going to set up on our machine. We have our machine frequency set up for 1 to go into that deeper penetration of the muscle tissue. Okay? We're going to put on our coupling agent, our gel. Make sure that we apply it liberally because we don't want there to be any areas where there's not gel that can create a standing wave. It can create unstable cavitation as well. Once we do that, we're not going to turn up our intensity until we actually start moving our sound head. We're going to hold it perpendicular to the surface, making full contact. And you can do the circular motion we talked about. You can do a linear where you mow the lawn back and forth. But whatever you choose, you want to go very slow, 4 centimeters per second, and make sure that you're covering every part of the area without going into areas that are not needing to be treated. Okay? So we're going to increase our intensity until he feels a very nice, pleasant warmth. Okay? All right. So that's 7.5 minutes, and we're going to continue this direct contact method. We're using good pressure so we can maintain contact. We're never coming off the surface on any part of our ultrasound sound head at all. It's going to make full contact completely this entire time as we go through the area of treatment. Okay? So when time runs out, then we're going to turn our intensity down to 0. Okay? We're going to clean our sound head. Also clean it with alcohol as well. We're going to wipe off the lotion. We don't have to clean his skin with alcohol because this can provide a moisturizing benefit as well to the area. And he also may be getting massage afterwards. Okay? So then our unit is turned off at this point. Okay? And we're going to make sure our patient remembers he can have soreness that can start a few hours after the treatment and last for a day or so. And that is very normal the first couple of times you do the thermal ultrasound treatment.